Good evening, viewers, and welcome to the Notice News Bulletin. This is Sukanya Bharadwaj, and now the news in details. In national news first, Prime Minister Narendra Modi today held an all-party meeting with leaders of different political parties through video conferencing. The Prime Minister discussed the future course of action with them in light of many states demanding an extension of lockdown after 14th of this month as a precautionary step in battle against COVID-19. Economic impact of the lockdown and measures to deal with it was discussed. Utilization of money released to state and concerns pertaining to daily wage workers and migrant workers were also discussed in detail. Many leaders have asked the government to extend the lockdown further. Opposition leaders also demanded for a greater financial stimulus to the states by the centre. Congress leaders Ghulam Nabi Azad, Shiv Sena leader Sanjay Raut and NCP leader Sharad Pawar were among those who participated in the interaction. In more national news, Union Home Ministry has directed states to ensure availability of essential goods at fair prices for public at large. In a letter to Chief Secretary's Union Home Secretary Ajay Bhalla has asked the states to deal strictly with offences of hoarding, black marketing, profiteering and speculative trading. He asked them to ensure proper supply of food items, medicines and medical equipments by invoking provisions of the Essential Commodities Act 1955. Measuring, including fixing of stock limits, capping of prices, enhancing production, inspection of accounts of dealers and other such actions will be undertaken by the states at the earliest and at regular intervals to ensure production and supply of essential commodities, he said. Moving on, the Union Health and Family Welfare Ministry has said a classification of health facilities and hospitals have been done to deal with the corona patients in the country. In a briefing, Joint Secretary in Ministry of Health and Family Welfare, Love Agarwal, said 3 types of healthcare facilities will be set up for various categories of COVID-19 cases as a mechanism to provide care to COVID-19 patients. He said these 3 types are COVID care centers, dedicated COVID health centers and dedicated COVID hospitals. All these facilities will have separate earmarked areas for suspect and confirmed cases. He has also launched a training module for health officials and workers, including doctors, nurses and other support staff. In Assam, Chief Minister Sarbananda Sonowal today took stock of the situation in Barak Valley, where 3 patients from Kachar, Karimganj and Hailakandi have recently been detected COVID-19 positive. Talking to media in Karimganj, he said government will take stringent measures against those who spread communal hatred in these trying times. Sonowal reached Karimganj district and interacted with Deputy Commissioner Anbamuthan MP and took stock of the safety measures taken by the administration in dealing with the disease. The Chief Minister received voluntary donations made by people representing various associations from across the district. The Chief Minister also visited Hailakandi and Kachar districts during the whirlwind trip. He held separate meetings with Deputy Commissioners of the districts at Hailakandi and Silchar and reviewed their preparedness against the COVID-19 outbreak.
Yes, sir. What are they doing? Yes, we are also
In news from Meghalaya, the government will put in place a strict regimen soon after the national lockdown ends on the 14th of April. Addressing the people live through a social media post after a detailed cabinet meeting, Chief Minister Conrad Sangma assured the people that the state will take no chances when it comes to the health issue and will strike a balance between the health concerns and economic priorities. He said a system will be put in place to allow Meghalaya to function in isolation. Pointing out that farming and agriculture activities will take place in staggered manner, the Chief Minister called upon the student community stranded outside the state to explore ways to delay their return due to the high incidence of infection in the rest of the country compared to Meghalaya, which till date has not yet reported a single case.
Would have on the health concerns. Friends, let me assure each and every one of you that the health is going to be and is the priority for the government. We are not going to take any chance when it comes to the issues of health, especially in this current situation that the state and the world and the country is facing. But at the same time, we as a government will also have to see the economic impact and the livelihood issues that are there for the common people. So therefore, the decision that the cabinet has taken is trying to balance the health concerns and ensuring that we are able to also address some of the economic issues that are being faced by the people. To put it in a nutshell, what we are trying to do is allow Meghalaya to function to some extent in an isolation mode. So this will be Meghalaya in isolation. So therefore, we may have construction work going on, but it will be laborers and people from the state only. No outsiders will be allowed to come in. No interstate movement will take place. We will allow farming to take place because farmers need to sow and this is the time to work. So therefore, that will be allowed. But there is no question of any laborers coming from outside and working in the farms.
In Manipur, close on the heels of launching a website to reach out to the citizens stranded outside the state after the nationwide lockdown, the state government on Tuesday launched another website to provide the latest and authenticated information on COVID-19. Chief Minister N. Biren Singh launched a website www.mncovid19 at the Secretariat Imphal. An Android mobile application MN COVID-19 has also been developed. Meanwhile, the Chief Minister's Secretariat has resolved to transfer 2,000 rupees from the Chief Minister's COVID-19 Relief Fund to bank accounts of those stranded outside the state. The stranded citizens may check the website www.tengbank.com. The Chief Minister informed this through a Facebook post. In Sikkim, Governor Ganga Prasad today held the second review meeting with the state government at Raj Bhavan on the current status of COVID-19 in the state. During the meeting, Chief Minister P.S. Tamang informed that the state government has accorded top priority to equitable distribution of relief materials to beneficiaries. He informed that in view of the likely extension of the lockdown beyond the 14th of this month, the government is taking several additional measures. The governor urged the government to expedite the process of setting up of a testing lab for COVID-19. The Union Health and Family Welfare Ministry has said a total of 773 new confirmed cases of COVID-19 have been reported in the country during the last 24 hours, taking the total number of cases to 5,194. The ministry said 402 patients have recovered and 149 deaths have been reported in the country so far. The Indian Council of Medical Research has said a total of 1,14,015 samples have been tested so far, including 12,584 which were tested earlier. The ICMR has approved 136 government laboratories and 3 collection centers to conduct the test of COVID-19. In addition, 63 private laboratories chains have also been given approval for the testing.
कोविड से रिलेटेड हैं उनको एंटीनेटल केयर और लेबर मैनेजमेंट के रिक्वायर्ड टेक्निकल गाइडेंस दी जाएगी.
In Mizoram, Health and Family Welfare Minister Dr. R. Lalthangmalia has announced that the newly installed COVID-19 testing laboratory at Mizoram Medical College has already started functioning by conducting first test on 14-member team of doctors, nurses and healthcare workers looking after the lone COVID-19 patient in the state. The minister said samples from nasopharyngeal swab of the medical personnel as well as one low-risk patient in the hospital have been tested negative. He assured the people that the lone COVID-19 patient is being given best possible care possible.
Kanen kolmek din hun with the hian acha nisindar khatle chambe khen khan kanin bia adin hun hi.
More than 2 weeks into the nationwide lockdown to contain the spread of COVID-19 in the country, the government in the frontier state of Arunachal Pradesh is ensuring that essential items reach every nook and corner of the state and no one is left out. Helicopter sorties are being carried out for the supply of essentials to far-flung areas not connected by roads. Before we wind up the bulletin, a recap of the headlines. That brings us to the end of this evening's bulletin. Thank you for tuning in.